Hey everybody, welcome to Cups of Joe's PT. I'm Joe Lavaca.
And I'm Joe Gambino.
Thanks for joining us on our first official episode, where today we will talk about something very near and dear to our hearts, as well as yours, the squat. And this is something that really grinds my gears a little bit as a PT, because so often over the last 6 years, the number one way that people deal with squatting and pain is simply not to squat anymore, and blaming the squat for a poor movement pattern or something else physiologically wrong in the system. So the alternative is straight leg raises, it's clamshells, it's open kinetic chain exercises that are trying to replace perhaps one of the most functional movements that we all encounter as human beings. And I say human beings, not young or old, because we all do this, and that somehow, some way is supposed to make everything better. So I don't quite understand it. What's your take on this?
I don't understand it either. As both a trainer and a physical therapist, I use for all of my clients and patients the squat as a foundational movement. It's one of probably 5 exercises that I do that every patient, client will always do, and it's will be in every program in some variation or another. And it's, a lot of times I get people coming up to me, it's like, oh man, Joe, squats hurt my knees. I had a patient the other day, I was like, oh, we're going to squat that. No, I can't do it. Squats hurt my knees. And I just want to rip my eyes out and just walk away, pull my ears off my head. I don't want to hear it anymore.
Aggressive.
Listen, I'm very passionate about this. All right. And then when I ask them to do a squat, the movement pattern is horrific. It's just not good technique at all. So really what's happening is that it's not the squat that's hurting the person's knees, it's really their movement pattern over time. Whether they're loading it too heavy or just moving poorly for a long period of time, that's what kind of gets them.
Yeah. And Joe brings up a good point about how we lose this movement pattern as we get older. If we Google good squat form, and we always kind of joke about it, and I see with my daughter at home, it's always a baby that comes up, or we see a picture of a baby at a continuing education course, and so on and so forth. So my notion is, if we're going to try to blame the squat for all these bad things that happen to the knees, meniscal injuries and arthritis and patellofemoral pain syndrome, well then, shouldn't, as a good father, every time I see my young daughter Avery squat, I kick her over and I say, no, you're going to hurt your knees. You can't squat below your toes. You can't bring your knees forward. You can't do this. You can't do that. It doesn't make any sense. Whereas if Avery can maintain that good form quality for her entire life, she should be able to squat just fine. And we were talking a little bit before about physiological forces on the knee and degeneration and all this other stuff, but tissue is tissue. And if we even compare it to the UCL, we know that the UCL fails way before peak torque during a throwing motion. So if that's the case, why isn't everyone blowing out their arm with every single fastball? It just kind of hasn't made a ton of sense to me.
Yeah. As we kind of look at things as just this joint or just that joint, when it's really a combination of your whole body kind of working together and putting things into place.
Right.
So what kind of substitutes, to say someone does have pain, what would you maybe do with them?
Right. Well, I think this is a really important part, and I think this is where a lot of PTs kind of lack foundational knowledge on exercise progression and regression. If someone's having a problem with a symmetrical loaded squat, well, try an assisted symmetrical loaded squat. Try a modified height squat. Try a split squat. Try a step up. Try a step down. Something that's going to have them interact with that foot on the ground so they can engage in their environment a little bit more and have that bigger carryover between sessions that we're looking for.
Perfect. So you're telling me that we shouldn't be using, or there are other alternatives for clamshells, straight leg raises, and the like?
I don't want to scare anyone, but yes, there is.
Oh. That's all we got today. A little bit of a power on the squat. Hope you guys leave some comments and give us your feedback and opinions on it. Subscribe to us if you like, or even if you dislike what we say. Get into the conversation with us. And until next time.
Think more, drink more.